So we have this gentleman here who on the befores, we can see his starting place on his nose and a big hole in his nose.
Yeah,
Is
yeah.
this a forehead flap? What happened for this guy?
Yeah, this is the, forehead flaps that we were talking about.
Yes.
So, yeah, so this guy, again, from one of my referrals, dermatology group here in Atlanta, this guy actually had a skin cancer on one side and already had a defect and kinda walked around with that for a while and then had
And
a
his
little
nose
kinda
isn't normal to it's not normal to start with.
Exactly, so it wasn't normal to start with, so he just kinda pushed through and said, I'll take care of it at some point," but then he developed a little red spot on the opposite side, and his dermatologist is like, "Hey, we've gotta do something." So he ended up getting that taken care of, and so he had a large wound of his tip of his nose, and obviously he couldn't just walk around with that, he couldn't ignore
No.
that, so he was referred to me, and so I decided, "Hey, look, this is perfect for that forehead flap." So we decided to do a forehead flap, and we do it in a couple of stages or a
Right.
couple of surgeries. So we do it first by developing or taking the tissue and putting it down on the defect to kind of like I like to have the analogy of bringing sand to the to your sand castle. So you got
Uh-huh.
buckets of sand, and you got all your sand there, and you stockpile it, and you're gonna use that sand to kinda craft. So we brought the buckets of sand, which is the flap,
Uh-huh.
just the skin, and then we
This is
let that
step
sit.
1.
Yes, it's step
Step 1.
1, and
Yes.
then we let that sit for couple of weeks up to a month or a month or 2, depending on how
And
I like to
and
judge it, depending on how the flap is doing, how the patient
And
is doing.
and so for the audience, what's happening with our buckets of sand during that time, if I may, is this correct that
Sure.
new blood vessels are going from the nose now instead of from the forehead, and now that nose skin and tissue is becoming for is excuse me, that forehead tissue and skin that came from here is now becoming nose skin and tissue. Is that a right way to think about it?
That is an accurate assessment. So what we're doing is we're taking this flap and it has its own circulation. And we need to make sure that the circulation from the nose kind of infiltrates that tissue and allows it to grow in and become part of the nose. Because at some point we're going to take off that extra amount of sand that we don't need once we build our castle and get rid of it. And so the
Right.
sand or the tissue that's left needs to be able to survive. And this allows the nose to provide circulation to that skin so that it can survive. So that's step 1 to bring in the sand or to bring in the flap. Step 2 was then to divide the flap or take out the extra amount that's not necessary, get rid of the extra sand you don't need since you've got all your house built, and then really tailor it or, stitch it in so that it is normal with the anatomy of the nose that was present before the defect. So we really kind of are a tailor. We tailor it in so
Mhm.
that it is seamless and it looks cosmetic. So it can be 2 steps. I often have gone to 3 steps. I don't know about you, but I do 3 steps.
I don't shy away from a third step, and when you hear I was just at our ASPS meeting a few weeks ago, and I just went into the forehead flap lecture because
Right.
that's just always fun to see and go
Sure.
to, and both guys are routinely doing a 3 when needed, and when your
Right.
result looks as good as this, you've remade his nose, it's prettier than it was to start with,
Thank
um,
you.
you're not gonna fault doing a 3rd stage to
No.
for the rest of your life, walk around where nobody's gonna think anything about your nose. Pretty
Absolutely.
amazing. Yep.
Absolutely, absolutely. So, yeah, I have to kind of graduate it to the 3rd step, and I prepare my clients for that. This is a journey. This is a marathon, not a sprint, so we're just gonna be ready from the beginning with that, and they've been gracious, and we've got some really nice results. So, again, that's one of my favorite procedures.
That's wonderful. What I have next is what looks like maybe to me could be transconj, could be subconjunctival. I don't know in terms of your incision choice, but just a pretty face to start with, and I can see how much more light is in the eyes and how much brighter, and just those bags being gone. Tell us a little bit about this case for
Yeah.
this patient we have here with what I believe looks to me like a blepharoplasty.
Yeah, it is a lower lid blepharoplasty or a lower lid eyelid for those of you, again, not the million-dollar words. So, this is a very pretty lady. And so we want to keep that in mind. So she has a little bit of excess skin from the puffiness, as you can see, and kind of had some of the same complaints that we talked about. Hey, I mean, she's got it put together in all aspects, but, people come up and say, hey, you look tired. Are you okay? Are you getting enough rest? And she just, that kind of wears on her. So she presented to me, and she had actually seen another plastic surgeon who wasn't really comfortable with that because she's a person of color. So concern about scarring and hyperpigmentation, and sometimes people get concerned about keloids, and rightfully so. In my
Mhm.
experience, for the face, especially the eyelids, I've not had that problem because the eyelid
Mhm.
skin is just naturally different and a little bit more delicate.
Yes.
But then, again, rightfully so, that plastic surgeon was a little worried because that's not their area of specialty and expertise, and
Right.
so they
Right.
referred them on. And so I decided when sitting down with her, I said, Look, I hear your concerns. I hear the concerns that you've articulated for me from the previous plastic surgeon that had now made you a little bit more nervous. I think you have some loose skin, but I think it's mostly due to the fat. I don't think we
Mhm.
need to treat the fat. And the way I look at this for your audience, there are three components mainly, and I'm being very general. You've got the skin that can be a problem. You've got the fat that can be a problem. And you also then have the tonicity or the laxity or lack
Mhm.
thereof of the eyelid itself.
Mhm.
So those 3 things are really at the front of my thought process. So for her, her lid tightness was pretty good. She didn't have a really floppy lid, so I didn't have to talk about addressing that in a very formal way. She does have a little puffy skin. Yes, we all can see that, but it's not enough that I think I need to make an incision on the outside to remove.
Mhm.
Nor do I need to add some type of energy, like a laser for people who don't know, to kinda shrink or tighten the skin. I really thought this was just the fat that was really kinda protruding forward. And so I said, "This is what we're gonna do. We're gonna make an incision inside the red of your eye so that we can hide it, so there are no external incisions. We're gonna take out fat, we're gonna redistribute fat. We're gonna kinda melt away fat so that we can get the nice contour from your eyelid to your cheek so that no one will know. And so I ended up doing a transconjunctival blepharoplasty, again, the $1,000,000 word, right through the eyelid, took out the fat, repositioned from fat, put a stitch in here, closed it up, and let her heal, and this was her result.
Beautiful. Beautiful. I
Thank
love that. Our last person is an unusual case, I'm guessing, at least for me, and probably
Yes.
for you as well. Patient goes from having, I'm guessing, a surgical misadventure, probably somewhere else, and just having all kinds of trouble in her tummy. And then in her after picture, she looks totally normal, lovely. What's going on there?
Interesting story, you're right. This is what I love about plastic surgery. This is where you get to be a chef and not a cook. You get the ingredients in the basket you get, and you gotta make something out of it.
Yes.
So this young lady is unfortunate, and this is a kind of a cautionary tale. We have a lot of competition in Atlanta for aesthetic surgery, as I'm sure you do in Missouri. She was in the wrong hands of a practitioner who's not trained as a plastic surgeon. So she
Mm,
had a BBL liposuction. She ended up having necrotizing fasciitis and was
mm,
septic and multi-system organ failure. Again, big words. So for your audience, she was very, very sick. She was in the ICU. All her organs were not working properly, and she
mm,
was going to die. And so
mm,
one of the guys I trained with in general surgery saved her life. He did the debridement, he got her kinda resuscitated and saved her life, but she ended up with this horrific scar in her 20s.
mhm,
And so she bounced around the city and ended up going back to him and say, "Hey, I just want somebody to talk to me about this." So he referred her to me. And so when she comes into my office and tells me the horrific story, I was, like, amazed that she survived and she was doing
mhm,
well from that standpoint. But I was like, "Wow," thinking to myself, "What am I gonna do with this? I don't wanna just
mhm.
take this out, I don't have enough skin." So, I just used our principles, again, it's the basket. I got a basket. What am I gonna do with it? So, I
That's
thought
plastic surgery 101, right? We're a
101
principle-based specialty.
for sure, for sure. So I said, "Look, I need extra skin. How can I get extra skin?" "Well, I can expand the skin." And so what I told her, I said, "Look, this is a marathon, not a sprint. we're going to place some balloons underneath your skin, one above your belly button, one below your belly button. And we're going to stretch out the skin very thoughtfully, on a weekly basis, 2-week basis to get extra skin above that scar. I don't know where your belly button is. You may have one, you may not. We'll see. But we need the extra skin so that I can go in and take out that wide scar and then take that excess skin once I remove those balloons at a second surgery and pull that skin down almost like a tummy tuck. So that's what I ended up
Mm.
doing. So the first surgery, I placed 2 expanders. I expanded her over about a 3-month period. Went in to remove the scar, and I was a little concerned about the scar. Scar was really plastered to the fascia, so I didn't know
Mm.
I was gonna get into the fascia, past the fascia, and what I was gonna find. But fortunate enough, it was just down in the fascia, and I was able to get that off. So the fascia for your audience, again, is the next layer above the muscle, so it's like a little leather covering. So I was able to peel the scar off the leather covering, took out the balloons. I found her belly button, which was
Lo and
which was
behold.
there and viable. It was healthy, and so it became then just a standard tummy tuck. I just pulled down the extra skin, you know, cut and removed it, sewed it together, brought her belly button through, put drains in, and we were on our way.
That's a home run.
Uh,
Congratulations.
thank you, thank
Congratulations
you.
to you and the patient.
Yeah,
That's fantastic.
she was really happy. Again, it's just again, it lends to self to, like you said, we just are have to think a little bit outside the box, use the tools that we have, and just kinda craft unique and individual treatments for each patient, not rubber stamp.
Hey, thanks for watching. We've got a lot more videos just like that one. We hope you check them out. So don't forget to like and subscribe our YouTube channel. We'd like for you to enjoy our content and share it with everybody you know. See you next time.